failure under the last government for primary care investment to keep pace with housing growth. With such a low share of ICB capital funding allocated to primary care by the last government, how can we make sure we do much better in ensuring that GP capacity expands at the same time as local growth?
Secretary of State.
I'm grateful to my honourable friend for that question. He's been raising these issues with me, in fact, before he was elected to this place on behalf of the communities he represents. As I said to my honourable friend, the member for Barking, we must make sure that additional housing, which is desperately needed, is also accompanied through health and care services. The Deputy Prime Minister and I are working together to achieve just that, and thanks to the decision taken by the Chancellor in the budget, we are able to invest in the health and care services this country needs and deserves.
Callum Miller. Callum Miller.
The Woodstock surgery in my constituency is not fit for purpose. In September, heavy rain fell and caused the roof to collapse, causing the surgery to close. The nurse literally sees patients in a broom cupboard. The GPs want to increase their capacity to see more patients, but have been unable to access sufficient capital from the Integrated Care Board. So will the Secretary of State meet with me and the Woodstock GPs to discuss how the reforms announced yesterday will help them build a new surgery so that they can see patients faster?
I'm grateful to the honourable member for that question. I'm incredibly sorry to the staff in that practice and to the patients that it serves for the awful conditions in which they're having to be seen and the conditions in which they are having to see patients. I think that is the epitome of the broken general practice system that we inherited. Thanks to the decisions taken by the Chancellor in the budget, we are able to invest in the capital estate need in the NHS. It will take time. We'd be delighted to hear more about that individual case to see how the ICB and the NHS can assist.
Chair of the Select Committee, Leyland Brown.
Mr. Speaker, and following from the theme of my neighbour in Bicester, may I make a plea for Summertown Health Centre, my doctors, by the way, so I declare an interest. They operate in an old Victorian building, desperate to move to a new premises. They were the top of the priority list, but the ICB say that there is no money, and they say that they have no pots at all that they can bid into in order to get this seen to. So would the Secretary of State meet me as well? You know, clearly there's £102 million spread across 50 projects in the country is not going to be sufficient. Can we get creative about how we can get Summertown Health Centre built in a new building?
Secretary of State.
Well, of course, Mr. Speaker, it'd be daft of me to say no to the Chair of the Select Committee. Otherwise, you'll see me in less pleasant circumstances. But just to say, in all seriousness, we are looking creatively at this issue. There are enormous capital pressures right across the NHS estate. We're regularly lobbied on new hospitals, for example, but it's also general practice, the mental health estate, and the rest. We'll do as much as we can, as fast as we can, think creatively about how we can get more capital investment in. I'd be happy to discuss that with her further.
Sir Hazelgrove.
Thank you, Mr. Speaker. And when I'm out regularly knocking on doors and listening to people across the Filton and Bradley Stoke constituency, one of the issues that residents raise with me most frequently are the challenges in even being able to book a GP's appointment. Could the Secretary of State please set out what his plans are for ending that 8 a.m. phone scramble, including for those who don't use apps and websites as confidently?
Secretary of State.
I'm grateful to my honourable friend for that question. As the Prime Minister set out in our elective reform plan actually yesterday, we're determined to make sure that accessing NHS services, including general practice or dentistry or other primary care services, are as easy and convenient as accessing any other services at the touch of a button via our smartphones. We've committed to that in the elective reform plan, which will bring benefits right across the NHS as we modernise. And of course, she's right to mention those who might not be either digitally connected or might not want to access services in that way. That's why I believe very strongly in patient choice, different courses for different horses, and in freeing up telephone lines with people like me booking via the app. We'll of course free up telephone lines for those who would prefer to access services that way.
Seamus Logan.
Thank you, Mr. Speaker. Is the Secretary of State aware that the increases to employers' national insurance contributions is actually reducing patient access to primary care? I met with GP representatives in Aberdeenshire and Aberdeen recently, and they tell me two ways that that's happening. One, they're having to let staff go, and secondly, some of the GPs are going to have to consider meeting these costs from their own pockets. So will he consider an exemption for GP practices in relation to these charges?
Secretary of State.
Well, Mr. Speaker, a rare admission of failure by the SNP in this House. I'm very sorry to hear that general practice in Scotland is in such a sorry state, because here in England we're investing £889 million into general practice, the biggest uplift in years. That's in addition to the funding I found to employ 1,000 more GPs onto the front line before April, because we are prioritising general practice. And as for the decisions the Chancellor took in the budget, as I said before the election, all roads lead to Westminster, and thanks to the decision a Labour Chancellor has made here in Westminster, down that road from Westminster to Holyrood are the resources the SNP needs to deliver the priorities of the Scottish people. If they can't, then Anas Sarwar and Jackie Bailey stand ready to deliver.
Shadow Minister Dr. Luke Evans.
To improve the access, government has announced a planned expansion of advice and guidance, where GPs will be paid £20 per advice and guidance request for further expert advice from consultants. How does the government expect this expansion to take place, and will it be mandating, given the current position of the BMA under their collective action is that GPs should, quote, stop engaging with e-referral advice and guidance pathway?
Secretary of State.
Mr. Speaker, I think the Shadow Minister will find that GPs welcome the £889 million uplift announced just before Christmas. That is the biggest boost to general practice in years. It is part of this government's agenda to fix the front door to the NHS and recognise the dire state that GPs were left under. Of course, with that investment comes reform. I think GPs would be delighted to manage more of their patients in the community if given the tools to do the job, and that's something this government is committed to do.
Dr. Luke Evans.
Well, going back to advice and guidance, GPs use advice and guidance when they've come to the summit of their knowledge and need specialist input. For example, I might, as a GP, see a rheumatology patient, ask for advice from a rheumatologist who may advise for specialist blood tests. The problem is, as the inquiring clinician, I'm legally responsible for those blood tests and have to pay for them out of primary care budget. So does the government propose that £20 will cover subsequent follow-ups, cover the cost of the suggested tests, and will the government be looking at a legal framework change given the expansion of advice and guidance on accountability for those clinicians making requests?
Secretary of State.
Well, firstly, Mr. Speaker, of course, advice and guidance, as he's already said, does happen in general practice. We want to see more of it. We have to give GPs the tools to do the job, and that's what we're doing. My honourable friend, the Minister for Care, will be talking to the BMA shortly in the context of contract negotiations in the usual way. What the Shadow Minister neglects to mention is that these reforms and these improvements to general practice are made possible thanks to the £889 million we are putting in investment he and his party oppose.
Liberal Democrat spokesperson Helen Morgan.
Thank you very much, Mr. Speaker. Dentistry is obviously a key part of primary care, and yet an estimated 5 million people in England have been left without an NHS dentist, and that's why today a petition is being handed in at Downing Street signed by more than 250,000 people. We've moved on from the election, but we don't yet have a timetable on when the negotiations for a new NHS dental contract might begin and when the rollout of another 700,000 extra urgent appointments will begin. Can the Secretary of State confirm what the timetable is for those improvements and what the government's plans are specifically in relation to the new patient premium, and offer assurances to dentists that any changes to the current model will be outlined in detail to them as soon as possible?
Thank you, Mr. Speaker. I'm grateful to the honourable member for that question. We are looking at two things. Firstly, making sure we deliver what we said in our manifesto, including the 700,000 urgent appointments, and we're determined to deliver those as fast as we can. My honourable friend, the Minister for Care, is having discussions with the BDA to that effect. He is also looking very closely, as am I, at the money that is already going into NHS dentistry, how that money could be better spent, and why it is that year after year, despite people's teeth rotting to the extent that they're having to pull them out themselves, or children are attending A&E to have their teeth pulled out, how it is that year after year we saw consistent underspends in the dentistry budget under our predecessors. We're determined to give dentists the tools to do the job so that patients can see a dentist when they need one.
Dan Cobb.
Question number 4, Mr. Speaker.
Minister.
Can I thank my honourable friend for his question and also for his campaigning on this important issue, and indeed for speaking so honestly about his own experiences during his time in this House. An additional £267 million has been invested this year to improve the quality and capacity of drug and alcohol treatment and recovery. We are committed to correcting the years of disinvestment in treatment and recovery services and ensuring that people can access the support they need.
Thank you, Mr. Speaker. The Minister's done it for me, but can I alert the colleagues to my interests in this area? Last month, the Advertising Standards Authority ruled against 7 companies posing as treatment providers or impartial advice services or failing to make clear their role in earning commission when they were in fact brokers. And I can tell the Minister that there are many more of these companies that escaped this particular ruling. They are able to mislead families whilst taking cuts of up to 40% of fees being paid directly to treatment providers. And they have, quite frankly, been able to run the sector like a racket. Can we make sure that this ruling by the Advertising Standards Authority is the start of something new where we can seek to regulate practices properly? And I could ask the Minister to meet with me and interested parties.
Mr. Speaker, attempting to exploit people with addictions is reprehensible. Yeah. Free drug and alcohol treatment is available in every part of the country, and I urge anyone who's struggling right now to visit the NHS addiction website. The CQC has said that it could take legal action against companies misusing its logo, and Google has said that it would remove search listings from these companies too. I'm more than happy to meet my honourable friend to see what more we can do to stop this outrageous activity.
Jess Brownfuller.
Thank you, Mr. Speaker. One of the services provided by primary care services for drug and alcohol addiction is that of social prescribing, and it also supports the government's aim of moving from cure to prevention, which is why I was shocked to hear that a primary care network in my constituency are reviewing their social prescribing offering across the Chichester district and proposing removing it altogether. So does the Minister agree with me that social prescribing is a key pillar of our primary care services, and does the money that is used need to be ring-fenced to protect that service across the country?
Minister.
Social prescribing is one of the tools, and it's an important tool in addressing public health concerns in each of our constituencies. But look, this government is committed to ensuring that we get those shifts from sickness to prevention. We will be ensuring that local areas have public health funding in reasonable time. We're about to announce this year's allocations in due course, and we need to make sure that local systems maximise the use of their money, and that certainly includes social prescribing.
Mitchell Maskell.
Thank you, Mr. Speaker. In 2022, there were over 10,000 deaths from alcohol use, and we know that over 600,000 people have an alcohol dependency. We don't need to just focus on treatment services and the funding of them, but also on prevention. The last government failed to bring forward a timely alcohol strategy. Could the Minister update the House on what he's doing to ensure that we are tackling this massive situation in our communities?
Minister.
My honourable friend raises a really important point here, and of course as part of the government's health mission we are producing a 5-point plan for prevention, and alcohol harms is one of those areas. I hope to be able to update her and this House in due course on the actions we will be taking to really drive down the prevalence of alcohol harms and indeed other addictions, because it is costing lives and causing misery in communities, and that's why this government is determined to tackle these public health problems.
Come on through, Mr. Shannon.
Very much for his answers. Minister, while there is community addiction services for those over the age of 18, worryingly across this great United Kingdom of Great Britain, those under the age of 18 are succumbing to alcohol addiction as well. So there doesn't seem to be any provision for those under 18. So I can ask the Minister very genuinely and helpfully, if I can, what the provision there would be for those under the age of 18, and will that be made available for the addiction problems are rising amongst the younger generation? Thank you.
The honourable gentleman raises a really important point here, and look, this government is committed to having the healthiest generation of children ever, and that means that we will have a concerted effort, Mr. Speaker, on a whole range of health issues that determine the health and well-being of young people, hopefully ensuring they become healthy adults as a consequence. Alcohol harms is certainly one of the considerations that we will be looking at.
Then Stewart.
Number 6, Mr. Speaker.
Secretary of State.
Thank you, Mr. Speaker. This government is delivering on its commitment to cut the NHS waiting lists and end the Tory backlog. We've taken immediate action with an additional £1.8 billion to support elective activity this year, funding that will support the delivery of our first step of 40,000 extra elective appointments a week. But of course, with investment must come reform, and the elective reform plan, published yesterday and announced by the Prime Minister, sets out how we will cut NHS waits to the 18-week standard, increase productivity, reform the system, and improve patients' choice and control over their own healthcare.
Lord Stewart.
Mr. Speaker, almost 1 in 6 Scots are stuck on an NHS waiting list. People are borrowing money and remortgaging their homes to go private because they can't bear the pain. With an SNP government that has abandoned the principles of NHS free at the point of entry, would my right honourable friend agree with me that Scotland's health service needs a new direction?
I strongly agree with my honourable friend, and as I said during the general election campaign and quoted regularly by the SNP, all roads lead to Westminster, and down that road from Westminster is a record increase in funding for the Scottish Government through the Barnett formula. I know the Scottish Government published its own NHS recovery plan just before Christmas. I look forward to reading it, though I know some have expressed concerns at the lack of detail on plans to drive down waiting times. The Scottish people can therefore compare and contrast with the ambition of our elected reform plan, which was announced by the Prime Minister yesterday, and then decide at the next Scottish elections who they trust to govern, the SNP with their rotten record or a Labour government that will get on and deliver.
Sir David Davis.
The Secretary of State knows I wrote to him before Christmas about the planned ward closures and degradation of services at Poole District General Hospital. Doing so would take beds, facilities and indeed employees away from the National Health Service. That will do nothing but undermine his real attempts to reduce waiting lists and indeed all the plans he announced yesterday. Will he look at these trust-level decision systems that lead to such catastrophic decisions which will undermine every aspect of NHS strategy and all he's trying to do?
Can I thank the right honourable gentleman for his question and for writing to me before Christmas. I recognise the pressures that have been placed on NHS commissioners in recent years and the pressures that's put on service configurations. I tend to support devolution of decision making with decisions about service reconfigurations taken closer to the communities they serve. I recognise also that commissioners don't always get it right, which is why engagement with members of Parliament and other democratically elected representatives is important, and ministerial oversight is important too. We will look seriously at the issues he raises, talk to NHS leaders. I know he will be doing the same. This is a government that's determined to give NHS leaders the tools to do the job so that we can get the right care in the right place at the right time, better experience for patients and better value for taxpayers' money.
Holly Billington.
Thank you, Mr. Speaker. In our growing community of Thanet, I'm sure my right honourable friend will share my delight that the NHS is currently looking to open the Thanet Integrated Hub in one of the most deprived parts of Kent. But perhaps he will also share my concern that Tory-run Kent County Council has now put in spurious objections to this development. Will he share my concern that unnecessary objections like this block access to healthcare and make it harder for the government and the NHS to cut waiting lists?
I'm grateful to my honourable friend for her question and for the work she's doing to improve health and care services for her constituents. This is a government that's giving health and care providers the tools to do the job. Of course, change will take time, but it is crucial, therefore, that we all pull together locally and nationally. And for the avoidance of doubt, this government is on the side of the builders, not the blockers.
Josh Babarin.
Thank you, Mr. Speaker. The NHS Confederation has said that for the government to be able to drive down waiting lists, the pause to the delivery of the new hospital programme must be as short as possible, and NHS leaders need clarity about timelines. With that in mind, will the Secretary of State tell leaders at Eastbourne District General Hospital, as well as our community in Eastbourne, precisely when the new hospital programme review will be completed so that we can get cracking with our upgrade in town?
I thank the honourable member for that question. I agree with him about the need for clarity and also consistency, which is why we undertook the review into the new hospitals programme, because the previous timetable of the previous government was a work of fiction and the money wasn't there. I hope to report to him and to the House shortly on that, with the undertaking that the timetable we publish and the funding provided by the Chancellor in the budget and at the spending review will mean that we will provide not just clarity but consistency, which is important for NHS leaders, important for patients, and also important for our construction industry partners that we need to work with.
Shadow Minister Dr. Caroline Johnson.
Thank you, Mr. Deputy Speaker. Sorry, Mr. Well, that's the last time I get called then. Thank you, Mr. Speaker. Yesterday, the Secretary of State said in relation to the elective backlog, and I quote, "Where we can treat working people faster, we will, and we make no apology for doing so." Now, Labour politicians have struggled to define what they mean by working people, but his words have caused anxiety. Can he reassure those with disabilities that prevent them from working, and retired elderly people who've worked all their lives, that they will not be pushed to the back of the queue, and that treatment will continue to be provided in the NHS on the basis of clinical need?
Secretary of State.
Of course, Mr. Speaker, clinical need is paramount and must always drive decision-making about who to treat, when, and the order in which people are treated. That's why I find the question posed so deeply disingenuous. We inherited NHS waiting lists that were record levels and waiting times which are frankly shameful. She should be apologising for her party's record, and she should also apologise for the two-tier healthcare system that sees those who can afford it paying to go private and those who can't afford it, working class people, being left behind. That's the two-tier system this government is determined to end.
Can we just be a bit careful with the language we are using? Dr. Caroline Johnson.
Thank you, Mr. Speaker. I think the Secretary of State needs to be careful with the words he used, as Mr. Speaker said, because his words did cause anxiety amongst people. And it wasn't a disingenuous question, it was a genuine question to make sure that people are reassured. It will not have escaped the Secretary of State's notice that it's cold outside. Removal of the winter fuel allowance has reduced elderly people's ability to follow the Secretary of State's advice he gave last week, which was to turn the heating on. What assessment has he made of the number of additional admissions that have been caused by his removal of winter fuel allowance, and what effect is this having on the government's ability to deliver its reduction in elective backlogs?
Thank you, Mr. Speaker. What the Shadow Minister neglects to mention is that the Chancellor has protected the winter fuel allowance for the poorest pensioners. She has also put in place the Warm Homes discount to assist people with their energy bills throughout the winter. If the Shadow Minister doesn't support the decisions the Chancellor took at the budget and ahead of the budget to raise vital investment for our health and care services, that's fair enough, but then she needs to tell people which NHS services is she cutting or which other taxes is she increasing.
Mr. Speaker, we've made clear in response to the report by Dr. Penny Dash that CQC is not fit for purpose and requires significant reform. We have increased our oversight of the CQC to ensure implementation of the recommendations in Dr. Dash's review, and will continue to monitor CQC's progress through this period of improvement. We're also supporting the swift and efficient recruitment of CQC's leadership roles, including the new Chief Executive, Julian Hartley, who started in December.
George Fenton.
Thank you, Mr. Speaker. It's inarguable that CQC needs some improvement and many who run care services in local authorities have little confidence in their performance. So I wonder if my honourable friend will agree with me that we could go some way to improving how it's viewed by looking at the use of single-word assessments, which create undue stress in social services leads, and have been raised by the Dash Review as insufficient in supporting local authorities to improve, promoting box ticking over real improvement, and giving little information to members of the public on the quality of social services provision.
Okay. Minister.
I thank my honourable friend for that question, and he is right that confidence is the key word here in the huge agenda that the CQC now have to carry out. Dr. Dash's review and Professor Mike Richards highlighted those serious failings that need to be readdressed. As one of our predecessors said, Mr. Speaker, priorities are our language, and currently a review of 1 or 2 word ratings is not a priority, but that will be kept under review.
Greg Ricker.
Mr. Speaker, does the Minister agree, and is she indicating that what she has alluded to today is a new start in the Care Quality Commission, and that things are going to change in terms of going forward for both staff and those who are the recipients of care?
Minister.
I think the honourable gentleman makes an excellent point, particularly regarding staff who need support to continue the important work that they need. But absolutely, a new start with new leadership is absolutely what they need, and implementation of those recommendations.
Tom Gordon. Minister.
Thank you, Mr. Speaker. With your permission, I'll answer questions 8 and 20 together. As Lord Darcy's independent investigation found, around 1 million people are waiting to access mental health services in England. This government will fix our broken mental health services by recruiting 8,500 more mental health workers, providing access to specialist mental health professionals in every school, and by rolling out Young Futures hubs in every community.
Tom Gordon.
Thank you, Mr. Speaker. In my constituency of Harrogate and Knaresborough, we've heard harrowing stories from people who've tried to reach out and get access to mental health services before they reach crisis points. Often people end up facing months, if not years-long waiting lists. And when it all too often does reach a crisis point, they end up having to access services as far away as Newcastle or Manchester. So what is the government doing to make sure that we can route local community mental health facilities in communities like Harrogate and Knaresborough?
I thank him for that question. In addition to the measures that I just set out, the Chancellor in the budget made funding available for expanding talking therapies for 380,000 extra patients. We have a £26 million capital investment scheme for mental health crisis centres, and we're also, as always with this government, investment goes with reform. We're reforming the Mental Health Act. Finally, that talk about doing that was first when Theresa May was in 10 Downing Street. This government is rolling up its sleeves and getting on with the job.
Yeah. Gideon Evans.
Thank you, Mr. Speaker. Taunton and Wellington is a trailblazer in taking mental health from hospital to community and from sickness to prevention. And the Trust is the first in the country to merge the mental health with the hospital trust. Will the Secretary of State meet with the Trust and myself to understand how successful that programme is, and also to discuss the much needed maternity and paediatric unit at Musgrove Park Hospital?
Minister.
I thank the honourable gentleman for that question. It sounds like there's some very interesting and dynamic and innovative work going on in the areas that he mentions, and I'd be happy to meet with him to discuss it further.
Dr. Peter Brinsley.
Mr. Speaker, I have just been visited by my former medical student who tells me that as a young doctor in Yorkshire working on an ITU, 40 of the 50 patients who were admitted with COVID died. Many of the healthcare workers are suffering from flashbacks and post-traumatic stress disorder. I'd like to know what measures the government is going to take to look after the mental health of the healthcare workers who so bravely helped us during the COVID pandemic.
Minister.
Well, I thank my honourable friend for that question, and he raises a really important point. It's an opportunity for us all, I think, to reflect on the incredible work that those involved in our health service do provide. In many ways, they're heroes, and we should absolutely acknowledge that fact. I think we absolutely need to explore the point that he's raised, and perhaps we could meet to discuss it further. I'd also be very happy to write to him.
Anna Dixon.
Thank you, Mr. Speaker. In England, over 200,000 people were waiting for an autism assessment in September 2024. In my own constituency of Shipley, some adults have waited for more than 2 years for an autism assessment. And one child has been waiting 8 years and is still waiting to receive support from child and adolescent mental health services. These delays have a profound impact on people's lives. Will the Minister commit to the mental health investment standard and ensure, as the government reduces waiting times, it does so for physical and mental health services for young and adults? Thank you.
Minister. I thank my honourable friend for that question. We do remain absolutely committed to the mental health investment standard. We've prioritised the expansion of NHS talking therapies and individual placement and support schemes, and we've provided £26 million of capital funding to open new mental health centres. But we're absolutely not complacent about this issue. The points that she makes about autism, that really is something that's a red light flashing on my dashboard, and I'd be happy to discuss that further with her.
So Desmond Swain.
9, sir.
11, don't worry. It's 11.
11, yeah.
Confusion. Who's doing 11?
I'm doing 11, sir.
Come on then,
Right.
let's have the Minister.
Got it. With your permission, I'll answer question 11, Mr. Speaker. Thank you very much. I thank the Right Honourable Member for his question. Counsellors and psychotherapists form an integral part of the NHS mental health workforce, delivering support to people with mental ill health across a range of settings in both children and young people's and adult services. We will publish a refreshed NHS long-term workforce plan to ensure that the NHS has the right people in the right places with the right skills to deliver the care that patients need.
Sir Desmond.
Is there a plan to maintain service provision where psychotherapists and counsellors operating in the charity sector have been hit by eye-watering cost increases as a consequence of the national insurance increase?
Minister.
Well, as I have said in answers to previous questions, and as my Right Honourable friend, the Secretary of State, says, there is something of a pattern emerging here where colleagues on the benches opposite say that they welcome the investment that the government has made, but they oppose the revenue-raising measures, but they refuse to set out whether or not they would be increasing taxes or cutting services. And I still haven't heard an answer to that question from the benches opposite.
Tim Rhodes.
Question number 12, Mr. Speaker.
Serious day.
Thank you, Mr. Speaker. This government recognises the crisis in social care we inherited, which is why in the last 6 months we've taken steps through the budget to increase investment in social care, to deliver the biggest expansion of carers allowance since the 1970s, to invest in the disabled facilities grant. But of course, as my honourable friend alludes to, we cannot deliver great social care without the workers who deliver it. That's why I'm proud that the care worker turned Deputy Prime Minister did, within the first 100 days, include fair pay agreements on the face of her landmark employment rights bill, so that we can give our care staff not just the pay they deserve, but the professional status, recognising the hard work they do as caring professionals. That is a crucial step on our path to build a national care service.
Martin Rhodes.
Does the Secretary of State agree that the SNP's National Care Service Bill in Scotland was a missed opportunity to improve pay and conditions for social care workers, particularly when comparing it to Labour's Employment Rights Bill, which does create the Fair Pay Agreement for social care workers?
I do agree with my honourable friend. I'm proud that this government, as I said, has taken quick action within our first 100 days. Thanks to the Employment Rights Bill, which is a UK-wide piece of legislation, this Labour government in Westminster is giving the Scottish Government the tools they need to do the job on establishing fair pay for care staff. And if they don't do it, Anna Sarwar and Jackie Bailey will.
Martin Vickers.
Thank you, Mr. Speaker. In North East Lincolnshire, over 800 staff are employed by a social enterprise operation that provides health and social care. I've been approached by many of the staff who are unhappy that they have not benefited from the increases that NHS staff have gained. They've got the support of the RCN, and they're looking for the government to provide Care Plus Group who employ them with resources to ensure that they are recompensed to the same level. What what is the Secretary of State able to pass on to them?
I'm grateful to the Honourable Member for that question. That's why, with our fair pay agreements, we'll be bringing together government, employers in both the public and private sector, and staff trade unions to negotiate the future for fair pay agreements that will benefit care workers right across the system and give them the professional status and career progression they deserve. Of course, the Chancellor also, through the budget, took steps to make sure we could invest in our social care services, and I'm deeply saddened that the party opposite has not supported that investment.
Dame Emily Thornley, congratulations.
Thank you very much, Mr. Speaker. Question 13.
Minister.
Mr. Speaker, I thank my new Dame friend for her question. The Department doesn't collect data on the number of people who have specifically received enhanced maternity leave entitlements. Access to an enhanced maternity leave benefit forms part of the total reward package for Agenda for Change staff, which is critical, we believe, for retaining our much valued and needed NHS workforce.
Amendment.
Thank you very much. Doctors throughout the NHS, no matter who employs them, have blanket maternity agreements, but nurses don't. So when I visited the River Health Centre, I found that nurses employed by Whittington Health were working alongside nurses employed by the GP practice, and they got completely different maternity leave and pay. So as we turn out our hospitals into the community and we do much more work in that way, these anomalies are going to get worse. It's not fair. I wonder what my honourable friend is going to do about it.
I thank her for that question. She does highlight a problem throughout the system, not just in her area. Self-employed contractors to the NHS GP surgeries are not bound by the national terms and conditions and can develop their terms and conditions as they see fit. They do have the flexibility to set terms and conditions to aid recruitment and retention, and we would anticipate that good employers would set wage rates and terms and conditions that reflect the skills and experience of their staff. That is better for staff and for patients. I know she'll continue to highlight that with her local employer, and it's certainly something we need to keep an eye on as we develop services further.
Pippa Hayles.
Thank you, Mr. Speaker. We all know... Question 14, thank you.
Mr. Speaker, we believe that every child deserves the best start in life. Due to the challenging fiscal context, we're prioritising family hubs and Start for Life funding to areas of high deprivation initially. We will consider the case for extension to South Cambridgeshire in future financial years.
Thank you, Mr. Speaker, and thank you for that response. We know how important early start in life is to give the best opportunities for all. Only half of upper-tier local authorities currently receive that prioritised Start for Life and Family Hub funding. 78 do not. In South Cambridgeshire, the offices are doing huge work to provide support and signposting without the dedicated funding, which means that babies, young parents, young families are not receiving the full benefits. Will you commit in the next spending review, will the Minister commit in the next spending review to committing that across the whole of England?
Yeah. Mr. Speaker, local authorities were pre-selected using the income deprivation affecting children indices, average rank scores with a rural and urban weighting applied. We know that tackling child inequalities in health and outcomes is absolutely crucial, and as resources allow, it is the ambition of this government to ensure that the Start for Life services reach every child.
Gregory Stafford.
Question 15, Mr. Speaker.
Mr. Speaker, I want to start by commending the Honourable Gentleman on his fundraising efforts to fight cancer in Surrey and his support for the brain tumour charity. We are committed to ensuring that people with brain tumours have access to more effective treatments and excellent care, including through our National Cancer Plan. We'll set out more details on this shortly.
Gregory Stafford.
I thank the Minister for the answer and for his Googling of my background. Early detection is essential to ensuring that brain tumours don't fall further behind other cancers. So can the Minister update us on what progress he's making to ensure that screening is prioritised in this government?
We absolutely want to ensure that there's early detection of these cancers. I've also recently met with the brain tumour charity to discuss how we can roll this out. Of course, this government is investing an awful lot of money when it comes to tackling cancers, but there's a lot more we can do when it comes to brain cancer.
Right, we come to topicals. Callum Miller.
Question number 1, Mr. Speaker.
Secretary of State.
Thank you, Mr. Speaker. We've been busy announcing investment in our hospices, an uplift in funding for general practice, action through the Disabled Facilities Grant, a new independent commission on adult social care, and yesterday the Prime Minister announced the elective reform plan. But as I said, the NHS is experiencing a period of significant winter challenge. The number of beds occupied with flu has been much higher than last year and is continuing to rise, with on average just over 4,200 beds occupied by patients with flu at the end of December, surpassing the peak of around 2,500 reported last year. We monitor the situation closely, working hand in hand with NHS England, care leaders, and I continue to chair weekly meetings with senior leaders from social care, NHS England and the UK Health Security Agency.
Callum Miller.
Thank you, Mr. Speaker. I'm sure the Secretary of State will share my shock and anger that a number of young people in my constituency of Bicester and Woodstock are waiting over 4 years for a first assessment by child and adolescent mental health services. So can the Secretary of State confirm that the commitment made yesterday by the Prime Minister that patients will not wait for more than 18 weeks for a first appointment will apply to CAM services in Oxfordshire?
Mr. Speaker, we are absolutely determined to improve the experience of children and young people on both mental health services and physical health services. I think there is more we are determined to do to make sure that mental health waits, paediatric waits are put into the spotlight and given the same attention as the overall elective backlog. I'm sure we'll have more to say about that when we publish the 10-year plan.
Adam Jogi.
Thank you very much, Mr. Speaker. I want to pay tribute to my constituents in Newcastle Lyme, Sheila and Joe Ward, who have long campaigned for the vaccine-injured and bereaved families after death of their husband and father. There have been 16,824 claims received by the Vaccine Damage Payment Scheme. Can I ask the Minister when people who are still mourning the loss of a loved one can expect to receive the compensation they deserve?
Minister.
In September, the Secretary of State and I met with the families of those who have suffered harm following the COVID-19 vaccination, including his constituent Sheila Ward, where they raised the need for reform of the Vaccine Damage Payment Scheme. We listened closely to those families and what they've been through and agreed to look at a number of options, noting these may need to be cross-cutting government decisions. We're also working with NHS Business Services Authority to improve claimants' experiences of the scheme and ensure that claims are processed quickly.
Can I just remind members not to walk past when the Minister's answering the members just ask the question? Please, have regard for each other. It's just a bad example. Let's go to Shadow Secretary of State Adega.
Thank you, Mr. Speaker. In the Prime Minister's announcement yesterday of his elective recovery plan, in fact mirroring that of Sir Sajid Javid in 2022, there was one aspect different. Our plan explicitly recognised the importance of the workforce being in place to deliver the 9 million extra tests and interpret the results, and set out plans to grow that workforce further. What plans does the Secretary of State have to boost the CDC-specific workforce over and above the plans he inherited from us to ensure his elective recovery plan is actually deliverable?
Secretary of State.
Mr. Speaker, the Shadow Secretary of State is absolutely right that we need the staff in place to do the job. That's why the funding announced by the Chancellor in the budget is absolutely central to delivery of this plan. Funding, I note, he opposes, which is deeply regrettable. But as well as additional funding, we also need to improve productivity. That's why the steps that are set out in the elective reform plan to free up not just patient appointments that are unnecessary or low clinical value, but also crucially staff time in productivity gains is also important, so that as well as making the most of the additional investment, we're also making the most and delivering value for taxpayers' money already going.
Come on, please help me a little bit. You've had a good run today. Don't spoil it. Come on, Adega.
Thank you, Mr. Speaker. On hospices, while his pre-Christmas hospice funding announcement was, of course, welcome, the vast bulk of it was, in fact, non-recurring capital funding, which cannot be used to help them cover the hiked employer national insurance tax on hospices' most precious asset, their staff. What steps is he taking to ensure that they receive recurring revenue funding to enable them to cover the additional costs?
Mr. Speaker, the £100 million capital investment we set out before Christmas is the biggest boost to hospice funding in a generation, and it comes on top of the £26 million we announced for the Children and Young People's Hospice Grant. He can't welcome the investment and keep opposing the means of raising it. Will he cut services or raise other taxes? He's got to answer.
Mr. Osborne.
Pharmacy First is an incredibly popular service that has allowed many residents in Chatham and Aylesford to be referred for illnesses or urgent repeat medicine supplies. Can the Minister indicate whether there warrants a further review and expansion of this offering to include further access to medicines, including those to treat common dental conditions with bacterial infections, so patients with these very painful emergency needs can seek immediate over-the-counter appointments?
Can we remember its topicals, please, Minister?
I thank my honourable friend. We're making a priority of resuming consultations with the sector to stabilise community pharmacy. Pharmacy First has built on existing services to increase the clinical scope. The conditions treated under Pharmacy First do vary across the UK, and the NHS will continue to keep this under review.
Claire Young.
Mr. Speaker, when we think of social care, we often think of those who are older, but at a recent device surgery, I met the mother of a 20-year-old with complex needs, which local services are unable to meet. This means the only option that would allow him to engage with his peers is residential care further afield, taking him away from his family. Will the Minister meet with me, my constituent and his mother to discuss how we ensure those with complex needs are properly supported?
I thank her for that question. I'm sure she would welcome the fact that we've found an £86 million uplift for the Disabled Facilities Grant, but the specific question that she raises, of course, I'd be happy to meet with her and discuss that further.
Joe Platt.
Mr. Speaker, groups like Action for ME and Long COVID Support tirelessly advocate for improved care for over 2 million people living in the UK. How will the Minister ensure that NHS reforms deliver timely diagnosis, effective treatment and long-term support for those affected?
My honourable friend raises a really important point. Now, NHS England is due to complete a stocktake of long COVID services throughout England at the end of this month. This will provide an accurate, in-depth overview not only of long COVID services, but also now of MECSF services too. The stocktake will provide a comprehensive and accurate national picture, identify key challenges and make strategic recommendations for future service improvement, development and assurance.
Speaker,
since 2017 I've been raising the crisis facing East Kent Hospitals Trust. 7 different health secretaries across those 7 years have promised much but delivered nothing at all. Patients continue to face unacceptably long waits on trolleys in corridors, and last month the Kent Online paper compared these conditions to a war zone with an average of 40 very ill patients a day facing more than 12-hour waits. Will the Secretary of State meet with me and the CEO of our trust, who's desperate for even the most basic diagnostic equipment, to ensure this doesn't continue to be the case for another 7 years?
Yes, Mr. Speaker, either myself or the Minister of State for Health would be delighted to meet the honourable member. She's right to describe the scale of challenge in urgent and emergency care. Of course, there are other challenges in East Kent, particularly in maternity services, which I'm acutely aware of too, and we'd be delighted to work with her to help solve some of those challenges in her community.
Natasha Irons.
Thank you, Mr. Speaker. Mr. Speaker, the family dental practice in my constituency of Croydon East has faced significant challenges caused by dental contracts introduced by the previous government. The pilot scheme they took part in caused long-lasting operational financial damages to the practice. So how will the Secretary of State support practices like the family dental practice in my constituency, and will he consider measures such as rebasing the UDA targets to help them overcome these challenges?
I thank my honourable friend. She's absolutely right. The NHS dental contract simply is not working. We're working with the sector to reform the contract with a shift to focusing on prevention and the retention of NHS dentists. We will deliver on our pledge to provide 700,000 more urgent dental appointments at the earliest possible opportunity, targeting areas that need them most.
Tim Farron.
Mr. Speaker, 1 in 5 social care jobs in Cumbria is currently unfilled, and the consequences are unbearable for those who are vulnerable and indeed are causing pressure on the rest of the NHS. Will he look carefully at the specific needs of rural communities like ours, where it's so much harder to recruit and retain social care workers?
Secretary.
Thank you, Mr. Speaker. I was in Cumbria only recently and struck by the fact that the care home I visited in Carlisle is delivering great intermediate care for the NHS at half the price of a hospital bed. A really good example of how social care often delivers better value and better care. But he's right about the recruitment challenges. We're determined to work with local training providers and the local university to make sure we recruit, grow our own in Cumbria and keep them in Cumbria too.
Johnson.
The East of England ambulance service remains at the highest escalation level 4 as the call handlers in Bedford remain under immense pressure after assisting in responding to 39,000 calls between Christmas and New Year. Despite this unprecedented demand, the Trust is considering closing the Bedford Emergency Operations Centre, putting nearly 200 jobs at risk. Does the Secretary of State agree that with resources already stretched to the limit, we must keep the experienced staff in Bedford who have helped saving countless lives in the region?
Minister.
He is right to highlight the particular problems in his constituency. The decisions on configuration of these call centres are a matter for local trust in consultation with staff and representatives, and I encourage him to continue to engage with the trust in the interest of his constituents.
Greg Smith.
Thank you, Mr. Speaker. Will the additional money announced for hospices before Christmas cover the full cost of the increase in employers' NI or not?
Oh, quick, Secretary of State.
Mr. Speaker, they can't on one breath welcome the investment and on the other hand condemn the means of raising it. Would they cut NHS and care services or would they raise other taxes? They've got to answer.
Cat Smith.
Thank my honourable friend for securing the land purchase for the new hospital in Lancaster, and will he meet with me to discuss how a new hospital will transform health outcomes for my constituents?
I'd be delighted to meet my honourable friend. She was literally the first person to lobby me about her hospital immediately after the general election, having already lobbied me before. I'm delighted that thanks to her efforts we have been able to deliver for her community. Indeed, thanks to your efforts, Mr. Speaker, for yours too. And I'd be delighted to meet with her.
Mike Martin.
Becky's son Will was a normal, happy teenager until he suffered multiple COVID infections. His mother tried to find out what was wrong with him, but found that in Kent there were no paediatric long COVID care services. Will the Secretary of State update the House on whether Kent, with a population of 2 million, will ever get a paediatric long COVID service?
I'm very sorry to hear about the honourable gentleman's constituent, Mr. Speaker. I know firsthand how complex and debilitating long COVID can be. As I mentioned in an earlier answer, there is a stock take taking place which should show where there are deficiencies. But let me make it clear, I want to ensure there are good services for people suffering with long COVID in every part of England.
Richard Quigley.
Mr. Speaker, the Isle of Wight doesn't just have a problem with its ferries, you're expecting that. We also have a huge problem with dentistry. We are a true dental desert. However, the size of our community means we're an ideal place to trial new approaches to dentistry, especially for children. Will you meet with me to discuss those approaches and improve dentistry on the island?
My honourable friend is absolutely right to describe the Isle of Wight as a dental desert. That's perhaps one of the reasons that the good people of that island elected a Labour member for the first time in history. Our ambition is to make sure that everyone who needs a dentist can get one. Sadly, 28% of adults in England, that's 13 million people, have an unmet need for NHS dentistry. I'd be glad to meet with my honourable friend to learn more about the experience of the Isle of Wight can improve services nationally.
Mr. Speaker, prostate cancer is the most common cancer in men and yet has no national screening programme. This is something we worked on in government, and I thank the Secretary of State for also taking an interest in this area. So will he join me in commending Prostate Cancer Research's excellent new report and urge his team to consider the findings, not least for increased screening of at-risk groups, so that we can not just save the NHS money, but more importantly, also save thousands of lives?
Can I welcome the former Prime Minister's question? He's right to commend the research. We are actively looking at it, and since he's here, we're taking the bill through. Can I also thank him for his leadership on tobacco and vapes too.
Deirdre Costigan.
Thank you, Mr. Speaker.
The last government treated mental health as a Cinderella service, with my constituents waiting days in A&E to be admitted to hospital and to mental health wards. The Solace Centre in Ealing Southall provides help and support in the community for those with mental health problems at a fraction of the cost of a hospital stay. So how does he intend to move more mental health services from hospital to the community and to create more great services like the Solace Centre?
I thank my honourable friend for that excellent question. She's absolutely right. This is a vital part of moving from hospital to community. The Chancellor made funding available for 380,000 more talking therapies for patients and a £26 million capital investment scheme for mental health crisis centres. There's a lot of work done, but there's a lot more still to do.
Vicky Slade.
Thank you, Mr. Speaker. Can the Secretary of State confirm what's being done to ensure patients with rare and complex conditions like functional neurological disorder and achalasia can access consistent coordinated care, including referrals to multidisciplinary teams that they need across the different symptoms that they experience?
The honourable member is absolutely right to raise cases where there are often multiple comorbidities or indeed complex conditions requiring a range of care services. That's why we need to design services around the patient and not expect patients to contort themselves around the services. Our approach to neighbourhood health services should make a real difference in this regard, but we've got to go further and faster on health and care integration, and we absolutely will.
Kevin McKenna, final question.
I strongly welcome the announcement yesterday about using things like community diagnostic centres to move services closer to the public. In places like the Isle of Sheppey, we're particularly exposed, but thankfully, as a coastal community, but thankfully with the new CDC, this will really help. Unfortunately, my experience in the NHS over the last few years showed that while the previous government talked about shifting care to the community, it failed to deliver. I would like to know from the Secretary of State what actual steps we're going to take for my constituents to show this is actually going to happen.
I'm delighted to have my honourable friend and his experience in this House standing up for his community and giving us his advice and wisdom as we develop our 10-year plan. We are already walking the talk on the shift to community, not least the big uplift in funding for general practice announced before Christmas, and the fact that even our elective reform plan that lots of people assume is just about hospital waiting lists, a big part of that was delivering the left shift by asking and funding general practice to do more to manage patients in the community.
That completes questions. We'll let the front bench change over. Right, we now come to the urgent question. Leila Moran.
The Secretary of State of the Foreign, Commonwealth and Development Office, if he will make a statement on the situation in northern Gaza.
Minister.
Thank you, Mr. Speaker. The situation in northern Gaza is dire. The UK condemns Israel's restriction on aid in the strongest terms. The scale of human suffering is unimaginable. We have been clear. This is a man-made crisis, and Israel must act immediately to address it. The need for humanitarian assistance to reach Gaza is greater than ever before. Close to 46,000 people have now been killed. All of Gaza's population is reported to face the risk of famine. Airstrikes within the designated humanitarian zone show there are no safe spaces left for civilians. Reports of up to 8 children having died from cold weather conditions are unconscionable. It is unacceptable that many medical facilities are no longer in use or are inaccessible to humanitarian actors, and we remain deeply concerned by reports of medics being killed or injured. I have raised this and will continue to raise this with both the Israeli Deputy Foreign Minister and Israel's ambassador to the United Kingdom. I have also specifically raised the detention of Kamal Adwan Hospital Director, Dr. Hassam Abu Safia, with both the Israeli Deputy Foreign Minister and Israel's ambassador to the UK. We urge Israel to urgently clarify the reasons for his detention and paediatrician Mohammed Hamouda, and all other health workers detained in Gaza. The UK is doing all we can to alleviate this suffering, Mr. Speaker. We have provided £112 million for the OPTs this financial year, including £41 million for UNRWA, providing vital services to civilians in Gaza, the West Bank, and Palestinians across the region, delivered through partner agencies. The UK is also supporting the provision of essential healthcare to civilians in Gaza, including support to UK Med for operating their field hospitals, and we've provided £1 million for the Egyptian Ministry of Health to support medically evacuated Palestinians from Gaza. The Foreign Secretary, working with his French and German counterparts, wrote to the government of Israel in November to press them to ensure adequate preparations for winter. Make no mistake, in lockstep with our partners, Mr. Speaker, we're continuing to exert pressure to make sure that northern Gaza is not cut off from the south, that Gazans are not forcibly transferred from or within Gaza, and that there is no reduction in the territory of the Gaza Strip. We need a ceasefire, we need hostages released, and much more aid into Gaza and civilians protected.
Leila Brown.
Thank you. Over 450 days on, we all know the statistics. 45,000 Palestinians killed, 100 hostages missing, 2.3 million people desperate. But I want to tell a single human story. I spoke before, Mr. Speaker, about my friend, consultant surgeon Mohammed, who operated on me when I had sepsis. His family are trapped in Jabalia refugee camp. They're elderly, sick. One is a 3-year-old girl. And we described how there are bodies strewn in the street. Well, I am sorry to report that this weekend, death didn't come knocking, but rather it was dropped by a precision drone as Mohammed's brother and his son walked 10 meters to get aid. The son died of a brain injury. 2 13-year-old girls and their mother have shrapnel wounds, and Mohammed's elderly father, who was already ill, is in hospital. That 3-year-old, her mother, and his mother are alone in a house with no one to help them get food. These were obviously not militants. They were sick. They are not legitimate targets of war. There is no excuse for this. Mohammed told me it feels like they're living in the Hunger Games, dodging drones, scavenging for the basics. Even if they wanted to leave, how can they? And so I want to ask the Minister, what part of international law makes any of this okay? Where is the accountability? Where is the justice? What does the Minister have to say to Mohammed, who spends his days saving lives here in the UK while his family are slaughtered overnight? And it's not just Mohammed. People in Gaza are trapped in a doom loop of hell. Hospitals decimated, ceasefires promised and never delivered. And so I press the government again. Is this really everything the UK's got? Have we deployed everything to make this stop? When will we recognise Palestine? Why haven't we stopped arms trade to Israel? And when will the government ban trading with illegal settlements? Mr. Speaker, the frustration is palpable. Our grief is fathomless. People across the UK are looking on in horror, and the horror in Gaza must stop now.
Minister.
Mr. Speaker, the honourable member speaks passionately about a situation that so few in this House can even imagine, and my thoughts are with Mohammed's family and the many, many other women, children and civilians who are caught up in this war. I've seen myself injured children across the border in Sinai, and the lucky ones, Mr. Speaker, who've been able to leave the Strip and access medical assistance. The whole ministerial team in the Foreign Office has these people in our mind each and every day, and I have been engaged through the break, as many others have, recognising that for most people in Palestine there is no break from a truly dreadful situation. The member asks, what do I have to say to Mohammed? And I am incredibly sorry for the loss that people are suffering in Palestine. I am incredibly sorry that we continue to assess that there is a serious risk of breaches of international humanitarian law in Gaza, and we are doing everything that we can to try and prevent them and reduce them. In relation to the arms that the honourable member has mentioned, we have taken decisive action to reduce the sale of weapons which are being used in the conduct of these hostilities in Gaza and West Bank and Lebanon. And we will continue to keep these matters under review. I can only join with the member in reaching out to those in Palestine in this situation. We have done much. We recognise there is much more to do, and my heart goes out to those people.
Chair of the Select Committee, Dame Emily Thornley.
Thank you very much, Mr. Speaker. May I begin by paying tribute to the bravery of the Honourable Lady in continuing to fight for the population in Gaza, even as her own family and friends are suffering the amount that they are. Mr. Speaker, my committee is currently undertaking an inquiry into the Israel-Palestine conflict, and we've heard again and again from witnesses, including both Israeli and Palestinian voices, that the UK could in fact be doing more to bring this conflict to an end. We've also heard from witnesses, including the former member for North East Bedfordshire, the former Minister for the Middle East, a very respected minister, that where UK action has come, it's been too little and it's been too late. Well, I know that the Minister is unable to comment on any ongoing negotiations. I would like to know this. What role is the UK playing in convening post-conflict discussions, and what does he see as a viable long-term resolution for Gaza?
Minister.
Thank you, Mr. Speaker, and thank you to my right honourable friend for her question. We have taken a very different approach, this government, to the one that came before us. We have taken immediate, rapid action, calling for a ceasefire, making decisions on arms that have already been mentioned, increasing the amount of aid available to the occupied Palestinian territories, being absolutely steadfast in our support to UNRWA, restoring funding that had been cut. Let us not think that there is no difference between the policy position taken by these ministers and those that came before us. And I do, my predecessor is a good and wise man who's done much in service of his country, but let us not have any illusion. There is a difference between what a Labour government has done in relation to the Middle East and what our predecessors did. I can reassure my right honourable friend that we are very engaged in the questions about what must happen next in Gaza. Clearly, Gaza needs a solution which works for its people, where Gaza is governed by the Palestinians under their own legitimate authority, in safety and security. There are a wide range of international views about how we might get to that objective, and we are playing our full part diplomatically to try and ensure that there is consensus.
For Secretary, Dame Priti Patel.
Thank you. And I'd like to thank the Honourable Member for Oxford West and Abingdon for securing this urgent question. Innocent civilians in Gaza are suffering and the situation is desperate. Everyone in the House recognises that, and we all want aid and support to reach them. But does the Minister also recognise that innocent civilians are being used continuously as human shields by Hamas, who have no regard for their safety or welfare? There are no excuses for the current situation. Well, perhaps listen to my comments and then he can comment afterwards. But getting aid over the border is absolutely critical. And in light of the comments that the Minister has already made, he will also recognise, notwithstanding his comments about the previous Conservative government, that that government actively identified different ways to get aid into Gaza and secure food aid in particular. And there was an appointment of a special representative for humanitarian affairs who was on the ground with a clear remit to address bottlenecks and to address these issues. There were clear proposals to increase the delivery of aid and support, to put them into the government of Israel, and there was active dialogue. And Israel did make a number of significant and welcome commitments. So can the Minister give details of the recent engagement on fulfilling those vital commitments, how they are being held to account, and whether the Foreign Office under his government has identified and proposed new and alternative routes for aid delivery in recent weeks? But importantly, Mr. Speaker, the only other way the conflict in Gaza will be brought to a sustainable end
and for this appalling humanitarian conflict and suffering to end is through the release of hostages held by Hamas, all of them. So can I ask the Minister, and I appreciate this is difficult and we've had debates on this previously, what discussions are taking place? The onus, as we know, is on Hamas, but importantly, what steps is his government undertaking right now? There are many hostages that we know of, including Emily Damery, as we've spoken about previously. All our thoughts are with them and their families. But we must know what the UK's position is. What points of influence do we have now with Israel in particular, but also in calling out Hamas? Secretary Blinken at the weekend was right to say in recent days, we haven't seen a greater condemnation. So, Mr. Speaker, can I conclude by asking the Minister, what are those points of influence and what is his government doing to address this fundamental issue and conflict?
Thank you, Mr. Speaker. The Shadow Foreign Secretary rightly raises the important role of the Special Representative for Humanitarian Affairs, who remains in post and continues to have dialogue with the Israelis and others about what can be done to ensure that adequate aid gets into Gaza. There has been a great deal of discussion about different routes, and I have been to North Sinai to see the routes in through Al Arishan on, and my colleague Minister Dodds has been in to Jordan to see the routes there. It is clear in all of these questions, the most fundamental question is who controls the crossings. In most cases, that is the Israeli government, and the steps that need to be taken, in our view, sit most acutely with the Israeli government. There are, of course, other questions which are important and relevant, not least to do with law and order in the Gaza Strip, Mr. Speaker, with our serious and concerning reports of looting. But getting the aid in is vital. That is through the crossings, and we have been raising these points with force with the Israeli government, and it has been disappointing to see with my own eyes British aid piling up in Al Arish, despite the good efforts of the Special Envoy and others to encourage the Israelis to make progress in delivering the flood of aid that they promised into Gaza. In relation to the absolutely vital... sorry, just a breath. In relation to the vital questions about hostages, Mr. Speaker, we are continuing to use all of our influence to try and ensure an early resolution to the hostage crisis, which has been going on for far, far too long. We must work each and every day to try and advance that. There is clearly a degree, in my view, of tactical leaking to the press about the latest, and I don't want to comment too much on press reports about the latest talks.
Chair of the Entitled Select Committee, Sarah Chair.
Thank you, Mr. Speaker, and thank you for granting this question. And I really thank the member from West Abingdon for all the work she's done trying to highlight the horrors that are going on. I'm interested in what assessment the government has made of Israel's actions in the Netzarim corridor, which Israel has cleared of Palestinian civilians in order to construct military roads and positions. One senior Israeli official told Haaretz that the area had been designated as a kill zone, with anyone who enters being shot. The same officer told Haaretz that civilians were knowingly killed and later designated as terrorists, with competitions between military units regarding who can cause the most casualties. I wonder what assessment the Minister has made of these alleged war crimes, what we're doing to document them and to stop them.
Minister.
Mr. Speaker, as you would expect, my department takes careful stock of all of the reports, including the ones that my right honourable friend mentions, and we include it as part of the regular assessments. We concluded one of those assessments recently, and I updated the House on that.
The Liberal Democrat spokesperson, Colin.
Thank you, Mr. Speaker. I pay tribute to my honourable friend, the member for Oxford West and Abingdon, for her powerful and sustained advocacy for Palestinians. Clearly, Mr. Speaker, the situation in northern Gaza is utterly dire. We need to see action from the government in the face of a dreadful and worsening situation. At the end of December, Israeli forces closed Kamal Adwan, the last functional hospital in northern Gaza, forcibly removed patients and detained its director, Dr. Abu Safia. The Minister says that he has raised this with the Deputy Foreign Minister and the Ambassador, but I wish to ask him, what consequences did he spell out to them if Israel fails to meet their obligations to protect civilians and sustain access to healthcare in northern Gaza? The Minister also referred to Israeli airstrikes in the allegedly safe zone. I've on previous occasions asked the Foreign Secretary to look again at a full ban on arms sales. Will the Minister now do so? We will only see an end to violence with a ceasefire. So can the Minister update the House on progress towards the release of the Israeli hostages held by Hamas and towards a lasting ceasefire? And finally, Mr. Speaker, in light of deep concerns about the direction this conflict might take under the second Trump presidency, and following remarks made by Israeli government ministers about annexation and actions on the ground in the West Bank to extend illegal settlements, does the Foreign Secretary agree that does the Minister agree that now is the moment to recognise Palestine on the 1967 borders?
Minister.
Thank you, Mr. Speaker. Taking the honourable member's questions in turn. So on arms sales, we have been clear, and I'm pleased to reiterate that clarity today. We have taken steps in relation to the weapons at issue in Gaza. We keep that under regular review, but we have taken clear, principled steps. If the question relates to the F-35 programme, I am happy to reiterate that we carved out that provision because there was no other way in order to meet our obligations in relation to international peace and security. That remains the position, and in relation to a ceasefire, efforts are ongoing. We hope to see an early resolution, but we have been here, I'm afraid, Mr. Speaker, many times before. These are incredibly fraught talks. Flexibility needs to be shown on all sides. The violence has gone on for far too long. We continue to call for an immediate ceasefire, as we have since we became the government. I have raised the situation in Kamal Adwan and the wider question that the provision of healthcare raises in northern Gaza. I have been clear, Mr. Speaker, with the Israeli government, the obligations that fall upon them under international humanitarian law in order to ensure proper medical assistance is available to Gazan people. They are entitled to that assistance, and those obligations fall clearly under international law, and we are clear with the Israelis on those questions, and including what the consequences are internationally if they are not met. The member also raises questions about legal settlements, and I am pleased to repeat the UK's position. We do not support annexation of Gaza. We support the 1967 boundaries, and we deplore illegal settlements, and that is why we took sanctions against them late last year.
Patricia Fergus.
Thank you, Mr. Speaker, and thank you to the honourable member for bringing this urgent question today. It is indeed urgent. The UK at the UN called for Israel to abide by UNSC Resolution 2286 on the protection of civilians and health care. It is clear Israel is not abiding by that resolution. So, the words having been uttered and ignored, what action will the government now take to ensure Israel is held to account for its actions?
Minister.
Mr. Speaker, we could not be more clear, publicly and privately, what expectations fall on Israel in relation to health provision. I have raised these issues, the Foreign Secretary has raised these issues, my ministerial colleagues have raised these issues. It is a source of enormous frustration to the ministerial team that we are still, this long into the conflict, still having to raise these issues, and we will continue to do so until there is some resolution, and that resolution must enable greater health care for the Palestinians of Gaza and the wider region.
Kit Malthouse.
Mr. Speaker, you and I have been through this rigmarole many times over the last 14 months, and I was going to ask today about the fate of Dr. Abu Safir, but I think we all know what's going to happen to him. I was going to ask about the freezing babies, the babies that are freezing to death while blankets are being denied entry into Gaza, but I don't think we're going to be able to do much about that, or indeed the denial of access for cancer medication or anaesthetic or crutches, or the bombing of every single hospital. The Minister said he and his team are frustrated. But given the partial application of international law and the government's unwillingness to take any significant steps to either compel the imposition of a ceasefire or compliance with international law, rather than frustrated, isn't he ashamed that millions of people in this country and around the world believe there is an inherent racism at the heart of British foreign policy in this regard, that says that Palestinian lives matter much less than any other lives, or indeed than Israeli lives. And if he is ashamed, and the Honourable Lady who sits next to him has taken these statements before, why are they hanging onto their red folders? Why aren't they standing down and compelling the government to actually do something active and physical to save these lives?
Minister.
There are places, Mr. Speaker, I will take lessons about shame, but it is not from the benches opposite me, particularly not on this issue. If the benches opposite me want to give me a hard time about what is being done in relation to the people in Gaza, I would turn to your own record, whether it's in relation to aid into Gaza, whether it's in relation to the ICC, the ICJ. These are sober issues. We deal with them with the sobriety that they require, and I would particularly, from the opposite benches, appreciate questions of that tone.
Abdul Mohammed. It comes.
Thank you, Mr. Speaker. In November, the IDF made an official statement that it is getting closer to the complete evacuation of northern Gaza and Palestinians will not be permitted to return home. In December, Doctors Without Borders reported on the clear signs of ethnic cleansing in the north of Gaza, and only last week the residents of Beit Hanun were ordered to leave the area. Ethnic cleansing is taking place before our very own eyes and the world remains silent. Will the Minister confirm that Israel must allow Palestinians to return to northern Gaza and that any settlements there would be illegal?
Minister.
Thank you, Mr. Speaker. I can confirm that it is the view of the government that Palestinians must be able to travel freely between North and South Gaza, that there can be no further illegal settlements, and that we will continue to condemn that in the way that we do in the West Bank. There must be no annexation of Gaza.
Mr. Carmichael.
Thank you, Mr. Speaker. Does the government acknowledge that what is happening in northern Gaza is a campaign of ethnic cleansing? And if he doesn't, what would he call it?
Minister.
Mr. Speaker, we have been incredibly clear about the position in northern Gaza, about our deep concerns, about both in relation to healthcare provision, in relation to aid going into the area, about the targeting of healthcare professionals, about the detentions, the importance of transparency of people where they have been taken, ensuring that they have adequate rights to their lawyer, that the ICRC can see people. The situation in northern Gaza is close to our minds. We have commented extensively throughout the winter period, and we will continue to do so.
Sam Rushworth.
Thank you, Mr. Speaker. Having listened as a member of the International Development Committee to evidence on Gaza, it is now clear that there have been egregious breaches of international law. Whilst I don't doubt the integrity and sincerity of the honourable gentleman, it's also clear to me that the actions taken so far by this government have either not shifted the dial an inch, or how much worse would it be? And I'd be interested to know, besides rhetorically supporting an international court, what this government will do to help to gather evidence, to protect witnesses, and to make sure that there is justice and accountability.
Minister.
Mr. Speaker, I'm grateful to my honourable friend for the question. I would take issue with it, though, which is that this government has done more than rhetoric, whether it is the £13 million of funding that we announced in December, the £112 million of funding for the occupied Palestinian territories, the quite different position we have taken on questions of international justice compared to our predecessors, or the extensive funding that we provide to the ICC each year to ensure that they can do their work. And I just want to be clear about that. We do not specify that funding in relation to Gaza. We give that funding to the ICC so they can pursue their work without fear or favour globally, and we will continue to do so.
Greg Smith.
Thank you, Mr. Speaker. The aggressors in this situation are the terrorists in Hamas. The ones that took and continue to hold hostages are the terrorists in Hamas. Therefore, would the Minister agree with me that the only concrete way to end this horror is for those terrorists in Hamas to release those remaining hostages, and talk of an unconditional ceasefire gives those terrorists no incentive to free those innocent people?
Mr. Speaker, Hamas are terrorists and they should release the hostages immediately.
Alice MacDonald.
Speaker,
Speaker. There are an estimated 50,000 pregnant women in Gaza with more than 180 births taking place every day. None of us can imagine the hell of Gaza, let alone being pregnant in it. Ultimately, we need a ceasefire, but the health system is on its knees. So please, can the Minister expand on whether you've raised specifically, he has raised specifically the issue of women and girls, and how our aid is being targeted to support access to sexual and reproductive health services?
Minister.
Mr. Speaker, we have raised these issues specifically, but I want to be straightforward with the House, which is we are clear insufficient aid of all kinds is getting into Gaza. So on almost any question that the House might put to me, there is insufficient aid, there is insufficient equipment, and there are insufficient provisions for people to be existing in Gaza under these conditions, and we will continue to raise that with force with the Israelis for as long as that situation remains.
Brendan O'Hara.
Thank you, Mr. Speaker. Exactly a year ago, Lord Cameron, when talking about the situation in northern Gaza, told the Foreign Affairs Committee that the conflict now is effectively over there. Unfortunately, no one seems to have told Tel Aviv because there are still babies freezing to death and the last hospital has been destroyed. And in that year, while the faces on the government benches may have changed, the UK's complicity in the mass killing of Palestinians remains as it has been for the past year. Given that nothing has changed, does the Minister genuinely believe that in another year from now he'll be able to say that continuing to arm the IDF was both moral and legal?
Minister.
Mr. Speaker, if words are to have meaning, clearly our policy is different from those on the benches opposite us, as I think they would accept. I do not want to see this conflict to continue for another year. The Palestinians cannot wait. We are doing everything we can. We have been calling for an immediate ceasefire since we became the government. We will continue to take steps to try and advance it.
Dr. Rosanna Allen-Khan.
Thank you, Mr. Speaker. I was left numb by the words a doctor wrote on a whiteboard of the Al-Awda hospital in Gaza before he was killed by an Israeli airstrike. Whoever stays until the end will tell the story. We did what we could. Please remember us. We need to know we did all that we could. I know the Minister and his department are pulling every lever available, but please, can we have an extra push to get the ceasefire deal over the line? We need to put an end to this horror.
Minister.
I thank my honourable friend for the question, and I remember those words from the whiteboard myself, and we must and we will spare no effort and strain every sinew to try and do what we can to advance the ceasefire as quickly as possible. It is already far too late.
Okay. Monica Harding.
Thank you, Mr. Speaker. I am pleased that the Prime Minister has recently met with the UNRWA Commissioner General Lazzarini and pledged further funding, but in 3 weeks, Knesset legislation to ban UNRWA comes into force. Yep. Lazzarini has said that dismantling UNRWA will collapse the UN humanitarian response in Gaza, and that the entire population of Gaza fears their only remaining lifeline will be cut. He also commented that since the beginning of the war in Gaza, Israeli officials have described dismantling UNRWA as a war goal. So will the Minister set out what consequential steps the UK will take if this comes into effect?
Thank you, Mr. Speaker. The Prime Minister was the first Prime Minister to meet Commissioner General of UNRWA. He did so in a week where we had announced further funding for UNRWA. We have raised these vital questions with the Israeli government. We did so over the course of the break. I myself have met Commissioner General Lazzarini, and I'll be saying more about UNRWA in the coming weeks if we are not in a position to see that the Israelis are taking the action necessary to ensure the sustained and continued support that Palestinians require and which only UNRWA can provide.
Abdul Khan.
Thank you, Mr. Speaker. Not one single hospital now operates in northern Gaza. Healthcare staff continue to be targeted, resulting in even more death of innocent civilians. We've heard the Minister, but surely what we're doing is not enough. What is it that you can do to stop this systematic dismantling of the hospitals in Gaza?
Minister.
Mr. Speaker, I thank my honourable friend for his question. He's right. What we have done is not enough, and you know it is not enough. Sorry, Mr. Speaker, you know that it's not enough because the provision is so poor in northern Gaza. We are distressed by the scenes in northern Gaza. We are distressed by the circumstances which the honourable member and many others have described, and we will continue to work as hard as we can, both in relation to UNRWA and directly with the Israeli government, to try and ensure that the aid provision, including in relation to medical provision, is provided with urgency, and the current situation is not good enough.
Rob Pritchard.
Speaker, of course Israel has the right to defend itself, but surely the life of a Palestinian child is as precious as the life of an Israeli child. And it is a breach of international humanitarian law for fuel and for food and for energy to be cut off from the ordinary Palestinians. And would the Minister just confirm to the House that the UK government has an independent foreign policy when it comes to Israel and Gaza, and it is a foreign policy set in Whitehall, not in Washington?
Minister.
Britain has an independent foreign policy set by the Ministers of the Foreign Office and the Prime Minister here, and I'm happy to confirm that to the House. Of course, for this government, the value of a Palestinian life is much the same, exactly the same as an Israeli life, and we deplore all of the civilian suffering that we have seen in this conflict, which, as I say, has gone on for far too long.
Mr. Speaker, thank you for granting this urgent question. One of the most appalling aspects of this conflict has been Israel's reckless disregard for not just civilian life, but for the lives of medical practitioners and of medical patients. Kamal Adwan Hospital, the last major facility within northern Gaza, is now out of service, as has been said already. But patients have been moved to a nearby non-functional and partially destroyed facility at the Indonesian hospital, and they're unable to receive care due to a lack of necessary equipment and supplies. So can the Minister confirm to me that one of the consequences of Israel's action will be that he assesses there has been a clear breach of international law, and that actually a consequence of that will be the continued suspension of weapons sales to Israel when it comes to Gaza?
Minister.
I thank my honourable friend for the question. We're following this situation closely. I raised the circumstances at the hospitals that he mentioned with the Deputy Foreign Minister on the 23rd of December. We are watching it very closely, and I can confirm that all of the developments in the conflict are considered as part of the regular assessment process and contribute to the assessments that we make.
Adnan Hussain.
Thank you, Mr. Speaker. Report after report from reputable organisations, the most recent being Amnesty International, have concluded that Israel's actions in Gaza are genocidal in nature. The scale of destruction in northern Gaza is now being described as much worse than the destruction in the aftermath of Hiroshima. Will this government now change its former position and identify that Israel's actions in Gaza are indeed genocidal in nature, and what actions will be taken given the grave nature of these facts?
Minister.
Mr. Speaker, determinations of genocide and war crimes are properly matters for international courts, and as the House knows, there is an international court process on that question, so I will not comment further on determination questions. What the member asks about what we are doing, let me recap again. We have taken action both in relation to arms, in relation to aid, in relation to diplomatic pressure on the Israelis, and we will continue to do so. The situation in Gaza is intolerable, and we will continue to take steps to try and reduce the suffering.
Debbie Abrahams.
Thank you, Mr. Speaker. I appreciate the difficult position the Minister's in, and he has spoken a number of times to the House specifically on this issue. However, I do have significant sympathy with not just the member for South West Hampshire and the frustration that he and others are expressing. The time now really is for action. Appreciate that we as a government have done a lot and were significantly different from the previous government, but that was a very, very low bar. It is important that this House has its view expressed through Parliament through the ministers. And in particular, I'd like to know whether the ICJ advisory opinion, which is absolutely crucial to the delivery of a two-state solution to a peace process, has the government finally accepted this? Thank you.
Minister.
Thank you, Mr. Speaker, and I thank my right honourable friend for the question. I'm always happy to hear the House's view on these issues. I have done so extensively and will continue to do so, and I know the strength of feeling across the House. In relation to the ICJ advisory opinion, we are still considering what was a complex and far-reaching judgment with significant horizontal legal implications as well as in specific relation to this conflict. At the heart of that advisory opinion is a concern about the statement of occupied Palestinian territory, and I am pleased to confirm, Mr. Speaker, that we continue to consider Palestinian territory to be occupied. We continue to take a position consistent with international law, and we continue to condemn illegal settlements, and that is why we took tangible, not just rhetorical, tangible steps against settlements in the West Bank, which were violent and illegal.
Sir Desmond Swain.
The Minister must be aware that there are honourable members on both sides of the House who were equally frustrated with the form of the previous administration as they are with this one. When he says that he's brought pressure to bear on the Israeli authorities, when that pressure manifestly fails to deliver, is there a plan?
Minister.
Thank you, Mr. Speaker, and I pay tribute to the honourable member who was also a Foreign Office Minister, and I hosted him in Afghanistan, which I'm sure he won't remember. I'm sure he'll remember Afghanistan. I meant me, Mr. Speaker. She's got vivid memories of Kabul at that time. We raise these issues with force, and there are consequences when there are sustained breaches of international humanitarian law, but I think, Mr. Speaker, it would be inappropriate for me to comment in too much further detail about how we conduct diplomatic relations on these questions.
So, Polly Billington.
Thank you, Mr. Speaker. Thank you for granting this question, and I'd like to thank my honourable friend for all the hard work he is doing in these very difficult situations. The 8 members of the Knesset have penned a letter to the Israeli Defence Minister demanding that Israel destroy all sources of water, food and energy for Palestinians in Gaza. They argue that Israel should do to the rest of Gaza what it has been doing to the north. Will this government ban entry of these 8 Knesset members who are openly calling for the extermination of Palestinians in Gaza?
Minister.
I thank my honourable friend for the question and the kind words. As the House will be bored of hearing me say, we don't comment on sanctions measures in advance of taking them. To do so would reduce their impact. But I welcome the opportunity to provide a brief comment on the proceedings of the Knesset. There is much said in other parliaments with which we do not agree. We are clear the obligations under international humanitarian law and the diplomatic obligations fall on the Israeli government. So we are clear with the Israeli government what their obligations are under international humanitarian law. We are clear about our policy position. I will refrain, Mr. Speaker, from providing detailed commentary on the proceedings of another parliament.
Jeremy Corbyn.
Mr. Speaker, it's quite clear that Israel's ability to destroy life in Gaza and kill 45,000 people and destroy medical facilities is only possible because of the supply of weapons, principally from the United States. Can he be very clear? Is Britain going to continue supplying weapons, including parts for jet planes and the use of RAF Akrotiri, as a route for weapons to go to Israel that are destroying life in Gaza?
Mr. Speaker, in relation to, I want to be clear about the honourable member's asked in his question about fighter jets. In relation to the F-35 supply chain, where it is not possible to disentangle components which might eventually end up in Israel, there we have made a carve-out for the arms suspension. Where we are directly selling fighter jet parts, whether they are F-35 or other fighter jets, to Israel, those licenses have been suspended. We will continue to have the same position in relation to the F-35 supply chain that has been discussed at this House at some length since it was announced in September, but we will, in relation to other fighter jets, take steps in accordance with the wider policy.
Yasmin Krish.
Thank you, Mr. Speaker. Aid access is non-existent for Palestinians in North Gaza. The UN has made over 160 attempts in the last 2 months to reach the civilians in North Gaza with almost zero access. And we've heard that babies have been frozen to death. The Prime Minister in October said, the world will not tolerate any more excuses on humanitarian assistance. So what further action have we done to ensure that the assistance does get to the people?
Minister.
Mr. Speaker, as I have set out this afternoon, we have taken further action, including further funding in December for UNRWA, but I want to be straightforward both with my honourable friend and with the House that the further action we have taken has not had the effect that we would wish, which is clearly that greater aid reaches the Palestinians. Until we do see greater aid into the Gaza Strip, we will continue to take those efforts, however frustrating it may be.
We're Hobbs.
Mr. Speaker, many of my Bath constituents are deeply worried about the intolerable suffering of the people in Gaza. But at this moment, they are particularly worried about the ban of UNRWA, which will come into force at the end of the month. And, Mr. Speaker, his previous answer to UNRWA is simply not good enough. Where is the urgency? Where is the urgency of doing something urgently about it, making an assessment what it means if there's no more humanitarian aid being delivered through UNRWA?
Minister.
Mr. Speaker, I'm sorry my answers weren't to the member's taste. To repeat, this Prime Minister is the first Prime Minister ever to meet a Commissioner General for UNRWA. In December, we announced further aid. We have been clear privately and publicly, repeatedly, with the Israelis, with UNRWA, with the wider UN system, of the vital role. We are doing everything that you could hope in order to try and ensure that aid continues. Clearly, there is no alternative to UNRWA at the scale that it operates. It is not possible to substitute for their function quickly or easily, and indeed they are mandated by the UN to perform the function that they perform. This is not a welcome situation. And if we find ourselves this month in a situation where UNRWA cannot function, then I will say more to this House at this point. But I can reassure you, Mr. Speaker, and the rest of the House that we are taking this issue with the full seriousness that it deserves.
John MacDonald.
I think the Minister has expressed his frustration and distress. I actually think the Minister shares the depth of anger that most of us have in this House. We've witnessed over the Christmas period, when we're celebrating with our families, the scenes of children starving and freezing to death as a result of Israeli actions. The only solution, up until now, the actions that have been taken clearly haven't had the effect we wanted. The only solution that we've had in the past is a total isolation of a country, economically and militarily, to prevent them performing war crimes in the way that Israel has. I think this government could take a leading role in that isolation of Israel to bring it to some form of negotiated settlement. But can I just say one thing that grates with me in particular, is that we have an Israeli ambassador who's an advocate of a greater Israel, refuses to recognise the Palestinian state, defies all the UN resolutions that have been passed about how we can secure that peace, and she still remains in this country. Why aren't we expelling the Israeli ambassador?
Minister.
Thank you, Mr. Speaker, and I thank my right honourable friend for his question, and I recognise the anguish in his voice about the scenes we have seen coming out of Gaza over the winter period, and he's right, I do feel that anguish as well. I think this whole House sees pictures of civilians in terrible distress and feels it too. I would say to my right honourable friend that he asked me about the Israeli ambassador. It is tempting to think that if only we had representatives more to our taste politically, then things would be easier. There is a disagreement, clearly. There is a disagreement between the British and Israeli governments about the conduct of the war in Gaza and the humanitarian implications that flow from it. We will continue to make that disagreement clear through all channels, both through the Israeli ambassador, directly to the Israeli government through the Foreign Minister, the Minister for Strategic Affairs, and the Deputy Foreign Minister. And we will continue to talk to the Israeli government about these issues. Indeed, that is the only direct route to secure the changes in the situation that we want to see.
Ellie Chance.
Thank you, Mr. Speaker. The UN says that the healthcare system in Gaza is on the brink of collapse. The International Red Cross says it's being obliterated in besieged northern Gaza. The WHO says that hospitals have become battlegrounds, and we've all seen the terrible scenes of patients and medics being forcibly removed from Kamal Adwan, the only remaining functioning health facility at that time. What further evidence does the Minister need to conclude that war crimes are being committed in Gaza and that a genocide is taking place? And how can he continue to justify the export of any arms to Israel, given that it risks making us complicit in the systematic destruction of healthcare in Gaza?
Minister.
Thank you, Mr. Speaker. In relation to the questions of legal determinations about genocide, I refer the member to my previous answer on the question. It's a question for international courts, and international courts are considering it. In relation to arms, I want to just once again reassure the House that the measures that we have taken in relation to arms licences are far-reaching. I have discussed already this afternoon the carve-out for F-35 parts, which will remain the position. The remaining arms licences are, I think, firstly, it is important to say many of them are not in fact arms. These are dual-use equipment which require licensing, even if they are not for use militarily. And even where they are military components, these very few of the remaining licences are going to the IDF. They are going, for example, body armour and helmets that NGOs would use when they visit Gaza. We have taken far-reaching action in relation to the concerns we have about the breach of international humanitarian law in Gaza, and we keep that under regular review.
Sarah Owen.
Thank you, Mr. Speaker. UNICEF reports at least 17,000 children in Gaza are unaccompanied. Some so young they don't even know their names. Continuous bombardment from Israeli forces makes family reuniting absolutely impossible. The brutal reality of injured children in Gaza, thousands of child amputees operated on without any pain relief and without any chance of recovery, including a 10-year-old left for 4 hours with rocket shrapnel in his leg in an overcrowded hospital that is now running out of fuel. So will the Minister commit to insisting the Israeli government honour a ceasefire, allow full access to aid and supplies? And if not, why aren't we considering an arms ban? Why aren't we considering further sanctions and to end this violence before there are no more vulnerable people left to protect?
Minister.
Thank you, Mr. Speaker. We are pressing the Israeli government to honour a ceasefire to show the flexibility and take the urgency required in order to ensure that hostages are released, violence stops, and Palestinians can return some form of dignity and security. My honourable friend raises the vital question of injured children in Gaza. There is not enough medical provision, not of the sophistication nor the scale required to deal with the very many children who have been affected by this war, some of whom I met in North Sinai. And as I said earlier, those children are the lucky ones. They were able to get to what is admittedly an overstretched medical system, but it is a functional medical system. That is not the case, as we've heard movingly from the honourable member and from many other colleagues over the course of this afternoon. The government is keeping these issues under review. When I visited Egypt and North Sinai, I was pleased to announce £1 million of UK aid to try and ensure that the Egyptian healthcare system can help Palestinian children under those circumstances. Regrettably, since that period, too few medical emergency, both children and adults, have been able to leave Gaza. We continue to raise these issues. My department was working on it through the Christmas break, and I don't want to talk about specific cases. We have had some success, but it is limited success in ensuring children and adults who either require urgent medical assistance or family reunification are able to leave the Gaza Strip and I hope to say a little bit more about that in the coming weeks.
Martin Vickers.
Thank you, Madam Deputy Speaker. Last Saturday morning, a constituent came to my surgery to discuss the situation in Gaza, and she reminded me that she had previously visited my surgery exactly a year ago to discuss the situation. And I recognise that the Minister was critical of the previous administration, and I think to some extent that's justified. But the reality is that the situation remains the same. We can all agree that Hamas should release the hostages immediately. But would the Minister agree that the continued bombardment of Gaza by the Israelis is not of itself going to deliver that? And if he agrees with that, has he made that very clear to the Israelis?
Minister.
Thank you, Madam Deputy Speaker. I regret the situation doesn't remain the same a year on. It remains far, far worse in the way that we have heard. The situation in Gaza, in northern Gaza, in Lebanon, in the West Bank, there has been material changes in the occupied Palestinian territories and the wider region, and the suffering suffered by the Palestinians, by the Israeli hostage families, by Lebanese civilians. There has been considerable further suffering over the course of this year. It is clear that the only way to get to a lasting, safer, more secure region, both for Palestinians, Israelis, Lebanese, Yemenis and many others, is for a proper diplomatic solution, a resolution both in the immediate terms through a ceasefire and a release of hostages, but moving back towards a solution, a two-state solution, which provides dignity and sovereignty for the Palestinian people. And we make that point with force to the Israelis regularly.
I will be trying to get everybody in, but members will see I'm aiming to finish this around 2, and there's a lot of members on the feet, so it'd really help each other if you could do your questions and your answers quite succinctly. Tan Singh Desai.
Thank you very much, Madam Deputy Speaker. So far, reportedly, 6 babies have frozen to death in Gaza, largely as a result of a denial of fuel heating, shelter and medical care. People's tents are being flooded in the winter rains, diseases are spreading, aid access is virtually non-existent, and there is not one single operational hospital in northern Gaza, with healthcare staff continually being targeted. So what is the UK government doing to ensure that Israeli Prime Minister Netanyahu immediately stops such atrocities, allows proper aid access into Gaza, and we finally get an end to the bloodshed in Palestine?
Minister.
I thank my right honourable friend for his question. I've spoken a little bit about some of the direct advocacy with the Israeli government conducted by ministers. That advocacy is also conducted by the special envoy that the Shadow Foreign Secretary referred to. We are clear at every level of the urgency of the situation in northern Gaza, and we will continue to have it in our minds each and every day until the situation stabilises, and it must stabilise with adequate both aid, medical assistance, dignity and sovereignty for the Palestinians.
Mike Martin.
Thank you, Madam Deputy Speaker. The case for further British action to protect Gazan civilians is unanswerable. Is the government's moral integrity being damaged by its inaction?
Minister.
Perhaps, Madam Deputy Speaker, the honourable member can be a bit clearer about what further action this government could be taking to try and protect Palestinian civilians. We are raising these issues.
The Palestinian state.
Order. You don't get 2 bites of the cherry. Minister.
The member mentioned sanctions, which we have taken extensive sanctions at the end of last year. I won't comment on further sanctions. To do so would be potentially to undermine their impact, but we keep these issues under close review. I've discussed the recognition of the Palestinian state and arms. I recognise the strength of feeling in the House. I recognise how desperately people in this chamber and across the world want to see an urgent ceasefire in Gaza, and that is the zeal with which the Foreign Office ministerial team approached this.
Spana Begum.
Thank you, Madam Deputy Speaker. Recently, a surgeon broke down as he told the International Development Select Committee of drones descending after a bomb strike to shoot children with wounds he believed and felt reflected some form of artificial intelligence. I understand that the government are currently saying that since September 2024, that UK-made arms are currently suspended where they may be being used against civilians. Notwithstanding what this exactly entails, the various details, caveats and definitions, can the Minister confirm and clarify today whether UK-made drones are being exported to Israel, or were being exported before September 2024, are being used to shoot civilians, including children, in the manner that was described by the surgeon?
Minister.
Madam Deputy Speaker, I'm familiar with the testimony of Professor Nizam Mahmood. I saw his videos from while he was in Gaza. He's an impressive surgeon and a friend to many in this chamber, and his testimony is harrowing. In relation to the drones, I want to be clear, the suspension of arms licences would cover exactly that such activity.
Ben Lake.
Madam Speaker. It's been estimated that over 650 attacks have been launched on healthcare facilities in Gaza, and more than 1,000 healthcare workers have either been killed, injured or detained since October 2023. I do recognise that the Minister has raised his concerns with his Israeli counterpart, but could he perhaps explain what the consequences will be if the Israeli government fails to listen?
Minister.
Ensuring adequate provision of medical assistance is an obligation. It falls on the Israeli government. We are clear about the status of these facilities under international humanitarian law, and we continue to raise these issues with force.
Stella Creasy.
Thank you, Madam Deputy Speaker. I'm sorry that the member for Buckinghamshire is no longer here, because he's right, Hamas are terrorists. But we need to be clear in this House, this is not being done in the name of the hostage families. The hostages' families do not want to see babies freezing to death in Gaza. They know this will not bring their loved ones home. Now, the Minister was clear with us earlier that he had seen Israel, he'd seen aid piling up at the borders, and that Israel controlled the borders. Impeding access to humanitarian aid is a direct breach of international humanitarian law. So, for avoidance of doubt, is it his testimony that Israel is impeding access at the borders by the way in which they are controlling them? I think he needs to be clear on this point, because it does have ramifications for us.
Thank you, Madam Deputy Speaker. I know many others in this House have done so as well, but I saw the hostage families in December, and my honourable friend is absolutely right. They are desperate for the safe return of their loved ones, and we hold them in our hearts as their agony continues yet further. In relation to questions about aid access, my honourable friend is of course right that these are questions which are considered, which are relevant to determinations of international humanitarian law. When we set out the assessment that underlined our action in relation to the arms suspensions, we made particular reference to the provision of aid into the occupied territories in Gaza, and I refer her to that statement. We tried to provide in as much detail as possible, and it remains the clearest articulation of our view about international humanitarian law and aid provision into Gaza.
Vicky Slade.
Thank you, Madam Deputy Speaker. It is quite clear that the Minister is frustrated, but thoughts and prayers are just not enough. What is the Minister doing to progress the Palestinian statehood that Norway, Spain and Ireland have all confirmed, and more than 100 other countries? The Foreign Secretary confirmed it would happen. What is stopping that from happening now?
Minister.
Thank you, Madam Deputy Speaker. I'm a Foreign Office Minister. I don't treat in thoughts and prayers. This House, of course, feels united in our anguish about what we see in Gaza. But what we do in the Foreign Office is seek diplomatically to advance a political solution, an immediate ceasefire, the release of hostages, and of course a two-state solution. That two-state solution must include a sovereign, viable Palestinian state alongside a safe and secure Israel. The routes to get there will be diplomatic. It is on those questions that we base our assessment of when would be the moment to recognise a Palestinian state. And I recognise that other close allies have taken different judgments than the UK has about when to recognise a Palestinian state. The question, I think, is not about just the question of recognition. It is about a viable state which exists and functions next to a safe and secure Israel, and that is the objective of this government.
John Pearce.
Thank you, Madam Deputy Speaker. In recent weeks, we've seen the distressing footage of Israeli hostage Liri Albag, who's been held captive now by Hamas for over 14 months. The hostage families, including Mandy Damari, the mother of British national Emily Damari, are campaigning day and night for the Red Cross and other humanitarian organisations to have access to the remaining hostages, but Hamas is refusing. Will the Minister condemn Hamas's refusal to secure humanitarian access to the remaining hostages and set out what steps he is taking to return those hostages to their families?
Minister.
Madam Deputy Speaker, I thank my honourable friend for his question, and I know how much time he has spent with hostage families over the recent months. I do condemn Hamas's refusal both to clearly release the hostages, British nationals and UK-linked persons amongst them, and I also condemn the lack of access for the ICRC and other medical agencies. I am consistent on this point, whether it is Israeli hostages or whether it is Palestinians in Israeli detention. The ICRC provides vital work, a life-saving function, and access should be provided in times of conflict to them on both sides. That is an essential humanitarian step. It has long been a principle of international law, and is a norm I'm deeply distressed to see being undermined by Hamas and others.
Stephen Gethings.
Thank you, Madam Deputy Speaker. That was one of the bleakest statements I heard at the start from the Minister about a man-made humanitarian disaster. A man-made humanitarian disaster, and the Minister was good enough to set that out. In the short term, that's a humanitarian catastrophe, and in the medium to long term, a brutalised population makes us all less secure, and in disrespect for international law, makes us all less secure. Now, the Minister asked what else can be done, and he talked about disagreements. It is not a disagreement where you advocate for the breaking of international law. Will he look at other measures, such as targeted sanctions, in order to bring this forward? When I was first elected, I got in touch with them straight away about an FBU donation, and I got much of the same words then as I do now. We're months on. Targeted sanctions, stopping the arms sale. The Minister wanted to know what else can be done. Plenty more can be done.
Minister.
Madam Deputy Speaker, the honourable member raises a fire engine that the FBU have generously donated to try and contribute to relief efforts in Palestine. It's an issue that has been raised by my own colleagues, in fact, in advance of this member. I am frustrated. I want to be clear. I am frustrated that I have not been able to secure that fire engine for use in Gaza, alongside the many other pieces of aid, the vital equipment that so many in this House know is not going to the Palestinian people. I would not want the member to think that I ignored his treaties in relation to the FBU donation, just as I wouldn't want any member who has asked me to try and secure aid access into Gaza, and where I have been unable to do so, to think that these are not issues that are raised regularly. I am a Labour politician. I am particularly responsive to the requests of our trade union partners. I would wish that I had been able to secure that fire engine into Palestine, just as I would wish to have been able to secure, whether it's the neonatal support that we've discussed, the medical support that has been raised, or the many other questions of international aid, which I have seen with my own eyes in Al Arish, which have not crossed through the Rafah crossing or anywhere else into Gaza. These are frustrating issues. I will continue, as will the rest of the ministerial team, to press for more aid to go into Gaza. Insufficient aid is going into Gaza, and we will continue to raise these issues.
Clive Betts.
Thank you, Madam Deputy Speaker. I just want to return to the issue of the recognition of an independent Palestinian state. The government's position, as I understand it, is that Israel has no veto over stopping the creation of a Palestinian state. The Minister just responded by saying to a previous question that recognition has to come through diplomatic efforts. Does those diplomatic efforts have to involve Israel? If so, and Israel refuses to cooperate in them, does that not effectively give Israel a veto over the creation of a Palestinian state?
Minister.
Madam Deputy Speaker, I think we have to be straightforward about the situation in Israel and Palestine at the moment. There are occupied Palestinian territories which have illegal settlements, which have an IDF presence. In order to get to a viable two-state solution, we are going to need agreement on both sides. The two states would need to live side by side with arrangements in place to ensure that both were safe, secure and sovereign. So I cannot see a route to a two-state solution that does not involve serious negotiations with the Israeli government in order to reach a lasting settlement. That is a statement of diplomatically essential. That is not to say that the Israelis can veto whether or not the Palestinians are entitled to a state, but it is a fact of reality that both states would need to work side by side to ensure each other's safety and security.
Andrew George.
Madam Deputy Speaker, the Netanyahu regime continues to seek to justify its cold-blooded slaughter of Palestinian people behind the dishonest facade that it's self-defence. And whilst the Minister asserts that the government is taking an even-handed approach in this regard, he'll remember that only 2 months ago the UK military intervened to intercept bombs coming into Israel to defend innocent life there. The question really is, and I think taking the passions of this chamber today, is what is the equivalence for the Palestinian people in respect of intervening to protect innocent life in Israel? What has this government done to do the same for Palestinian people in Gaza?
Minister.
The honourable member refers, Madam Deputy Speaker, to missiles sent by the Iranians to strike Israel, and we will act in Israel's legitimate self-defence in accordance with international humanitarian law. We do not want to see Iranian missiles rain down on Israeli civilians. The military questions are very different between a situation where Israeli troops are inside Gaza. This is not missiles crossing international borders. This is not going overseas. This is a totally different military scenario. In fact, there have been a number of occasions where there are risks of direct exchange between Iran and Israel, and the military questions, as I know many in this House will know, about whether or not the UK could act to take down missiles will be very dependent on the particular circumstances. The question, I think, at the heart of what the member poses to me is, are we even-handed on questions of international humanitarian law? And we are, Madam Deputy Speaker. We are clear that it is with great regret that our close partner Israel is acting in a way that causes us concern about serious risks of international humanitarian law, and we have said so as clearly and as explicitly as we can.
Harpreet Upal.
Thank you, Madam Speaker. And can I return to the issue of UNRWA? Philip Lazzarini, who is the head of UNRWA, visited Parliament just before Christmas, and he was very clear about the dire consequences if operations are banned. This will impact schools, the provision of primary health care, and they also deliver a number of municipal services in Gaza. So